Do you have pain in the lower back or around the back of the hips? Or do you find it painful when you're just standing or when you go walking? Or maybe you're pregnant and that you're having constant pain around the hips. Hi, my name is Quentin and I'm a physiotherapist here at Pain Free Physiotherapy and Allied Health. And I'm here to talk to you about Sacroiliac Joint Dysfunction or SIJ pain. The sacroiliac joint is formed by the tailbone or the sacrum and the pelvic bones, which is the iliac bones. Now this joint is surrounded by many ligaments and muscles to reinforce the joint as it needs to support the body's weight. Usually there is very little degree of movement, as little as approximately 2 to 4 millimeters of movement at the SIJ. One of the more common causes of SIJ pain, particularly in women, is due to pregnancy. Now during pregnancy, the SIJ becomes hypermobile due to the hormonal changes, meaning there is more movement than normal. As the body prepares for childbirth, the ligaments that were supporting the joint are much more relaxed. So the SIJ can be prone to more stress from the different walking pattern and the extra weight from the baby, and therefore create pain. Now, different walking patterns can also be caused by other factors, such as having leg differences, or ankle sprains, or any other leg injuries. And these can all place increased stress to the SIJ. Now, another cause for hypermobile sacroiliac joints may be due to weakness of the surrounding muscles. So this can include the buttock muscles or the glutes, the transverse abdominis muscle, or even the pelvic floor muscles. Alternatively, the SIJ can be in a positional fault, meaning that the joint is not sitting in the optimal position to function, and then this can lead to associated muscle spasms and pain. Symptoms may mimic other common low back pain conditions and therefore be difficult in accurately diagnosing SIJ dysfunction. Now, doctors may suggest anti-inflammatories or pain relief. However, this does not actually address the cause, but rather mask the pain. And for pregnant women, the safety of the fetus during pregnancy may be a concern, especially if you're taking lots of medication. Now, ice packs can be used to reduce inflammation, but inflammation may not be the cause for the SIJ pain. There have also been many pregnant women who prefer to use heat packs to help relieve the pain, and it's up to your preference. Your physiotherapist may advise you to wear a sacroiliac belt that helps stabilize the SIJ, as well as perform strengthening, stabilization, or stretching exercises to increase motor control and stability. At Pain Free, we're experienced at using a holistic approach to assess and treat your symptoms. We will go through a head-to-toe examination to identify other causes that may have led to your SIJ pain, with a big focus on the hips. Now, in many cases, the problem can be from the hips. However, there can also be other contributing factors elsewhere that contribute to your SIJ pain. For example, we've found that very tight muscles in the thigh or in the lower leg can also contribute to the pain. At the end of the initial treatment session, we'll always go through 3 main things in the treatment plan. Number 1, what is the cause? Number 2, what treatment do you need? And number 3, how many sessions and how long will it take for you to achieve your goal? Let me show you some techniques that can help if you're experiencing SIJ pain. The first one is SIJ walking. To be more specific, this is a right innominate posterior rotation mobilization with movement walk. This means that as you walk, the right innominate or the right hip bone is rotated backwards by the therapist while you walk. Now, if it is right-sided SIJ pain, the right hand of the therapist will wrap around the side of the right leg towards the front, and the fingers should just be under the bony part in front of your hips. The left hand will be on the sacrum, which is the tailbone, and will be as close to the SIJ as possible. And then the therapist will apply a small pull backwards to make a posterior rotation with the right hand while keeping you stable with the left hand. And then you start walking. One helpful tip is that both of you should be stepping at the same time. That way you don't bump into each other's feet. Now, if this technique is effective, then the patient should feel pain-free while walking, while the technique is applied. Often the result can last after the application of the technique, as it corrects the positional fault. Another technique that may help with your SIJ pain is a muscle energy technique. This involves lying on your back, and then bring the painful hip or leg up and hold it with your hands. And now you want to push the leg down into your hands and keep it in place. The trick is to have equal force through your hands and your leg. And after 10 seconds, you want to relax and then bring the leg out closer and repeat. Now you can do this at home as a home exercise if this technique helps. So if you or anyone you know is suffering from SIJ pain, especially women who are pregnant or they may have a broader pelvis, or still not getting the results that you want from other treatments, feel free to contact our clinic and we'd be happy to answer any questions about SIJ pain.